Anxiety is a natural emotional response to situations perceived as stressful, uncertain, or threatening. It is characterized by feelings of worry, fear, or unease, and can manifest in physical, emotional, and behavioral symptoms. While occasional anxiety is a normal part of life, excessive or persistent anxiety can interfere with daily functioning and may indicate an anxiety disorder. In this video, we are going to break down what anxiety is and how to deal with it. There are two main types of anxiety, so-called normal anxiety and clinical anxiety, also known as anxiety disorder. Normal anxiety is a temporary response to a specific situation, such as an upcoming exam, job interview, or public speaking event. This type of anxiety typically resolves once the stressor is gone. Clinical anxiety is an excessive, persistent worry that occurs without a clear trigger or lasts longer than is appropriate for the situation. Common anxiety disorders include generalized anxiety disorder, which is a chronic and excessive worry about various aspects of life, such as health, finances, or relationships. Panic disorder, which is a recurrent and unexpected panic attacks, characterized by intense fear and physical symptoms like a racing heart or shortness of breath. Social anxiety disorder, which is a intense fear of social situations due to concerns about judgment or embarrassment. Specific phobias, which are irrational fear of specific objects, situations, or activities. For example, heights, flying, spiders. Obsessive compulsive disorder, which is a repetitive, intrusive thoughts, obsessions, and behaviors performed to reduce anxiety. Post-traumatic stress disorder, which is anxiety distress following exposure to a traumatic event. Separation anxiety disorder, which is an extreme fear of being separated from loved ones. Anxiety arises from a combination of genetic, biological, environmental, and psychological factors. Common contributors include genetics, since family history of anxiety disorders may increase risk. Stress, as chronic stress from work, relationships, or health problems can trigger or worsen anxiety. Trauma, since experiencing or witnessing a traumatic event can lead to anxiety disorders. Personality, a certain personality trait, such as perfectionism or high sensitivity, may predispose individuals to anxiety. Brain chemistry, as imbalances in neurotransmitters like serotonin and dopamine can play a role. In medical conditions, because anxiety can be a symptom of underlying medical issues like thyroid disorders or heart conditions. Anxiety can cause various physical issues such as rapid heartbeat, shortness of breath, hyperventilation, sweating, shaking, muscle tension, headaches, dizziness, fatigue, etc. Anxiety can also cause various emotional issues such as persistent worry or fear, have restlessness or irritability, have difficulty concentrating, feeling overwhelmed and out of control. Besides physical and emotional issues, anxiety can cause behavioral issues as well, such as avoidance of situations or activities that trigger anxiety. Therefore, if you are experiencing any of these issues, it could be a good indicator that you may have anxiety. However, please do not be alarmed, as anxiety is very normal, although you should seek professional help. If you notice that your anxiety interferes with your everyday life, or if it causes severe distress, or if your anxiety is accompanied by panic attacks or persistent physical symptoms. In these cases, it's very important to consult a healthcare professional for proper evaluation and treatment. Effective treatments for anxiety depend on its type and severity. Common approaches include Psychological therapy, and there are a few types of psychological therapy. First, we have cognitive behavioral therapy, which helps identify and change negative thought patterns and behaviors. Then we have exposure therapy, which can, with gradual exposure to feared situations, help reduce avoidance and fear responses. And finally, we have mindfulness-based therapy, which encourages living in the present moment to reduce worry. If your therapist prescribes medication, you can deal with anxiety by taking antidepressants, anti-anxiety medications, and beta blockers. If the medication and therapy are not sufficient to help you deal with anxiety, you can also try to change some things in your regular everyday life, such as having regular physical activity, by having balanced diet and hydration, by getting enough sleep, and by managing your stress. And finally, you can try to talk with your friends, family, or support groups, as talking can reduce feelings of isolation and anxiety. To summarize, anxiety is a natural response to stress, but when it becomes excessive, persistent, or uncontrollable, it can evolve into a disorder. Understanding the symptoms, causes, and treatment options is essential for managing anxiety and improving well-being. That's it from me. Thank you very much for listening, and until next time, see ya.